If you've been dealing with heel pain for more than a month, you need to watch this video now. My name is Dr. Andrew Schneider, and as a podiatrist in Houston, Texas, I've helped countless patients finally get rid of their plantar fasciitis after everything else failed. Today, I'm going to show you exactly why your heel pain won't go away and what you need to do differently. Before we dive into the real reasons your heel pain persists, I want to make sure you have all the information you need. I've written a comprehensive guide about heel pain and plantar fasciitis that goes even deeper than what we'll cover today. You can get this guide completely free at www.heelpainbook.com. I'll mention this again later, but I wanted you to know about it now because the information inside can save you months of unnecessary pain. Let me share something that happened in my office just last week. A patient came in frustrated because she tried everything: stretching, ice, rolling her foot on a frozen water bottle, but nothing worked. What she didn't realize is that what most people don't understand is that plantar fasciitis isn't just one condition with one solution. It's actually a complex problem that requires a targeted approach based on your specific situation. Think of plantar fasciitis like a leaking roof. You can keep putting water buckets down to catch the water, but until you address the actual source of the leak, the problem will keep coming back. That's exactly what happens when people try random treatments without understanding the real cause of their heel pain. Let's talk about why traditional treatments might not be working for you. The first reason is something most doctors won't tell you. Your plantar fasciitis might not actually be plantar fasciitis. I know that sounds confusing, but hear me out. The pain from your heel could be coming from a compressed nerve, a stress fracture, or even a problem with your fat pad. Each of these conditions require completely different treatment approaches. But let's assume you have true plantar fasciitis. The second reason traditional treatments fail is they're not addressing the underlying biomechanical issues. Your plantar fascia is like a bowstring on the bottom of your foot. When you walk, it's designed to naturally flex and stretch. But if your foot mechanics are off, that bowstring gets pulled too tight, leading to micro tears and inflammation. This is where custom orthotics come in. And I need to be clear about something. I'm not talking about those flimsy insoles you buy at the drugstore. Custom orthotics are precisely crafted to your foot's unique structure and walking pattern. They'll work by correcting the underlying mechanical issues that caused your plantar fasciitis in the first place. Think of them like eyeglasses for your feet. They don't cure the problem, but they correct the underlying issue so your body can function properly. Now let's talk about some advanced treatment options that most people don't know about. The first is shockwave therapy, and despite its intimidating name, it's actually a very safe and effective treatment. Shockwave therapy uses sound waves to stimulate healing in your plantar fascia. It's like giving your body's natural healing process a turbo boost. Let me explain how shockwave therapy works. The sound waves create controlled microtrauma to the affected area. This might sound counterintuitive. Why would we want to cause more trauma? Well, it's like when you exercise. The small tears in your muscle during a workout actually trigger your body to build stronger muscle tissue. Shockwave therapy works the same way, triggering your body's natural healing response and increasing blood flow to the area. Another cutting-edge treatment option is platelet-rich plasma, or PRP. This treatment uses your body's own healing factors to accelerate recovery. And here's how it works. We draw a small amount of your blood, concentrate the healing platelets, and inject them precisely where they're needed in your heel. Think of it like sending a specialized repair crew exactly where it's needed most. The beauty of PRP is it's using your body's own natural healing factors, so there's no risk of rejection or adverse reaction because it's your own blood. Studies have shown that PRP can be particularly effective for chronic cases of plantar fasciitis that haven't responded to other treatments. But here's something crucial that you need to understand about both shockwave therapy and PRP. Timing matters. These treatments work best when combined with proper biomechanical support, and that's why I often recommend custom orthotics alongside these advanced treatments. It's like fixing a car. You wouldn't just put new parts in without also fixing the alignment issue that caused the problem in the first place. Let's talk about your lifestyle for a moment because this is something that often gets overlooked. Your daily habits can either support or sabotage your recovery. For example, walking barefoot around the house might seem harmless, but for someone with plantar fasciitis, it's like trying to heal a sprained ankle while continuing to twist it. The same goes for your shoe choices. Those comfortable old shoes might feel good, but if they're worn out, they could be making your condition worse. I tell my patients to think of shoes like tires on a car. They need to be replaced regularly to maintain proper support and function. Here's another common mistake I see: people stretching too aggressively. While stretching is important, aggressive stretching of an inflamed plantar fascia can actually make the condition worse. It's like pulling on a rope that's already fraying. You're more likely to cause damage than help. Instead, I recommend a combination of gentle stretching and strengthening exercises. The key is to focus not just on your feet, but your entire lower body. Your plantar fasciitis doesn't work in isolation. It's part of a connected chain that includes your calves, hamstrings, and even your lower back. Now let me address something that might be worrying you: the possibility of surgery. The truth is, surgery for plantar fasciitis is rarely necessary. With the advanced treatment options we have today, like shockwave therapy and PRP, along with proper biomechanical support from custom orthotics, most people can find relief without surgical intervention. If you're struggling with persistent heel pain, don't wait any longer to get help. The longer you wait, the more likely it is that your plantar fasciitis will become chronic and harder to treat. I offer comprehensive evaluations where we can determine the exact cause of your heel pain and create a targeted treatment plan. Before you go, make sure to get your free copy of my heel pain guide at www.heelpainbook.com. It contains detailed information about everything we've discussed today, plus specific exercises and tips you can start using immediately. The link is in the description below. And if you found this information helpful, please give this video a thumbs up and subscribe to the channel. I post new videos regularly with crucial information about foot health and treating common foot problems. Thanks so much for watching, and have a great day.